Medical healthcare is a medical service provider. We were listed in Hong Kong in 2016. I joined this company in 2014, so it has been 6 years. I worked at Cathay Pacific for 13 years before this job. The owner, founder, and chairman is my long-time best friend. So we knew each other since primary school, and we went to the same secondary school and university. Eddie started this company in 2005. We started off doing medical aesthetics, and then the main brand is 𝗙𝗏𝗏, and we moved on to currently having 19 different medical disciplines, including medical services with beauty or medical services unrelated to beauty, for example, chiropractor, dentistry, advanced imaging centers, surgery centers. We are the biggest non-hospital medical group in Hong Kong in terms of revenue. And after 6 years with this company, I've seen it grow from a few hundred staff to now around nearly 200 staff. When we were listed, we only had 20-something doctors working full-time for us. Now we have almost 100. So that's the history of the company. Yeah. I think the medical industry is the private medical industry is very fragmented. There are many clinics with only one doctor, small operations. When we faced the pandemic, we all faced a problem with resources first. No masks, not enough masks, not enough sanitizers, not enough resources to make sure that we can provide a safe environment for our patients and clients. So that was a challenge. And as you can see, you just mentioned rightfully, is that many smaller clinics or smaller non-essential businesses, they have to shut down because they don't have the resources and they are fear of the pandemic. But luckily, we are a ListCo, and also we have the scale. So, and we had the foresight to order masks in December. So we had enough masks, we had enough resources, and we can do all the precautionary measures before reopening the clinics. So we have been doing our best. As you mentioned, people do need to see doctor, and people do need our services. So it was our thinking and our principle to keep on going, even though it's not easy and it's also costly. And frankly speaking, during these few months, it's not really that profitable comparing to normal days. But we still, and if I close it down, actually, we might be able to save more cash in some sense. But of course, luckily that we decided to continue with the business, and our clients are really grateful for what we did. And we actually have been developing telemedicine, which you can stay at home through online platforms and see a doctor. And then 𝗏𝗏𝗏, one of our partners, will be delivering medicine to your home. So this is what we have done on the telemedicine side. We also have been providing vaccines to help people, or not the coronavirus vaccine, of course, but other vaccines that would help people to be more prepared for other diseases. So we're doing our best to, and we also have provided a health program at a discount to all our clients, all Hong Kong citizens, and also free for frontline medical professionals in the public sector. So we have been providing different health conscious or disease prevention schemes to make sure that people can utilize this time while they're at home or they are not as busy as before. They can be more health conscious, do more health screening, find out what's wrong with them, and guide themselves to a healthier life. I think the more or less for the medical business, without the beauty element, the specialty services, and those are not quite affected. In some cases, if they have, some of them, for example, like ENT cardiothoracics or day surgery, that people would go to the hospital to do it in the past, they would prefer to do it at the clinic now, because the chances of getting infected would be lower. That was a growth area. We also see an increase in telemedicine, as we just mentioned. People would be more willing to see a doctor online rather than coming to the clinic. Another area that has been growing quite well is pain management and chiropractor. I think many people had this problem of back pain because of iPhone and laptops and everything, and neck pain, and they didn't have time to treat it during the normal time. So they have a problem, but they don't want to see a doctor, they're just too busy. They take some Panadol and they just go through it. But nowadays, since they have time, so that area, they would come to see a chiropractor, really treat the source of the problem, which probably is their bad posture or their bad habits. So they come here, do the stretching and the treatments, and also we teach them how to work in a better posture, and also provide equipment for them to use at home to sit better, work better. Yeah. We are a very young company, and our team is also quite young. So we have specialists that are very advanced in terms of their knowledge and also their reputation in the worldwide stage. For example, we have a urology surgeon who has been using robotics to do surgery. So they can do very micro surgery, very precise, and the chances of infection will be much lower. He can even do remote. The patient and the robot can be somewhere else, and he could be somewhere else doing those kind of surgeries. Another area is advanced imaging, MRI, CT scans. We're using artificial intelligence to help screen the advanced image. Of course, till today, we still need the doctor or the radiologist to do the final checking. But we can increase the efficiency and the productivity by using advanced artificial intelligence. We're also working on some diagnostic panel, so that through asking simple questions, answering simple questions, the computer can already diagnose your sickness as a prelim diagnosis, and then the doctor, of course, can re-examine the results and see if that's the same as what he thought. And again, that would increase the accuracy and also the efficiency and productivity, just to name a few. A few things that we want to focus on. First of all, we want to consolidate the Hong Kong market. As you've said, we are growing very fast through organic growth and also mergers and acquisition. So we've just done a few. We just announced M&A just yesterday. We'll try to, through M&A and organic growth, to build more medical discipline, because we want to create a one-stop platform for the whole family of our clients to come with whatever medical needs that they have. So the more variety that we have, the more complete the solution. Second of all, we will expand in the Greater Bay Area, which is a lot of good, a big population comparing to Hong Kong. We're talking about 70 million people. which is larger than UK. The GDP is larger than Australia. So it's a really, really big market. So we will be looking to establish 30 to 50 centers in the Greater Bay Area in the next 3 to 5 years. We already have some medical aesthetics establishment there, and we are now working with the local partners, again, well-known large corporations, listed companies we're working with, and see if we can grow the GBA area together. So hopefully in the next 1 or 2 years we can be more complete in terms of offerings, and also the geographic reach would be beyond Hong Kong. Yes. I think the coronavirus the pandemic has given us an opportunity, I think, to review what things that we were doing in the past. Are they necessary? Are they value-adding? Many people, of course, are quite affected. Business are affected, health is affected, and social distancing is not something easy to cope with. But I think it's an opportunity for us to advance ourselves. Telemedicine, for example, has been something that we've talked about a lot, but we haven't been doing. I think this has been a chance for us to explore it. Definitely it is much more convenient and much more value-adding to our clients. So there are many, many things I think we should rethink and use this opportunity to improve. So that is what I would say to our clients and our business partners, is that although it is not easy times, difficult times, but I think if we can be positive. I actually had a saying to our staff 2 months ago, when life gives you lemon, you turn it into lemonade. So I think it's not something that we hope for, to have a virus or have a pandemic, but since it's here, let's try to make good use of it and improve ourselves. And once it's gone, we truly believe it will go away someday. We will be bigger, better, and stronger.